Time for some clinical peanuts.
Challenges, costs, timelines, everything I'll be sharing. And obviously, I'll give you my personal insight as well. So let's begin. Yes. So basically, the FRC Opt is actually the Fellowship of the Royal College of Ophthalmology. The exam is conducted by the RC Opt, that is the Royal College of Ophthalmologists, UK. It is based in London, and it is a recognized postgraduate qualification in the UK. So, for example, in India, we have 3 years, then we get your MS, we get DNB, 2 years, we get diplomas. So, these are our postgraduate qualifications. Similarly, in the UK, the training is from ST1 to ST7, that is 7 years of training. And for those trainees to be able to be a consultant in the UK or be able to, consider themselves as a postgraduate, they have to get through this exam. So that is the importance of this exam in the UK. So if you give FRC off, you are considered at par with the UK graduates when you want to go for a job. So they will definitely consider you at par. Obviously, NHS experience adds a bit for them, but to be able to, land us substantially academically, knowledge-wise, this is the exam. And it's a pathway to specialist recognition in the UK and internationally. So why I have added internationally, because European countries do consider RCOFT. Middle East, very much. They do consider RCOFT even more so than our own DNB, which is very surprising. But if you have your DNB and your RCOFT, FRCOFT, it's wow. Also, Australia. Yeah. So if you have FRCOFT, if you've done 1 year of experience in NHS in the UK, you can get a direct entry to into Australian ophthalmology stream. Yeah, you can do that. That's possible. It's just that you have to get the right degrees and the right contacts, but it is doable. So that's it. Okay, moving on. Um, so why FRC for international graduates? The reason is that people want to try outside, want to try UK. So we have heard about PLAB, right? FRC oft is one exam which bypasses PLAB. Okay, initially we had FRCS Glasgow, which used to give GMC registration, but that has been scrapped now. During my time, my seniors, my colleagues, we used to give FICO. So FICO used to bypass some steps and used to give, if you clear FICO advanced or some things like that, you directly get entry to FRCS Glasgow, give the third exam, and that gives you GMC, but that has been scrapped off. Okay, so there's one way to get the GMC registration is either FRCS Glasgow entirely without FICO route, or you do FRC oft. But now even this has been tweaked a little, which I checked recently, and only FRC oft is considered to be able to give GMC registration. So this is the update which people are not aware of. I myself had started giving FICO. I gave my 2 exams, but then later I just was going through stuff and I realized that, oh, the guidelines have changed, the rules have changed, which is why I shifted the entire thing. I started giving FICO, but I shifted to FRC oft entirely because, yeah, my plan was to get a GMC registration. So what is GMC registration? So for India, we have NMC, we have MMC registration, we have our state medical council registrations, right? So in the UK, you have GMC registration. It gives you license to work in the UK. So that is the importance of GMC. Without GMC, you will not get any job. It's like hands down. GMC is essential. So to be able to even get an entry into the UK, you need GMC. There's one way to bypass GMC. It's called dual sponsorship pathway. I myself tried a lot about it, but you need sponsors. And unfortunately, for Ofthal as a branch, Ofthal does not have very good dual sponsorship opportunities in the UK. Other branches like ortho, radiology, patho, psychiatry, they have sponsorship pathways in those streams, but unfortunately, ophthalmology doesn't. I have already I've spoken to a few consultants in the UK, and I've told them to do something about it and raise this to the Royal College. maybe they should start a dual sponsorship pathway for Oftal as well. But other than that, right now, this is the only way to be able to get a job in the UK, unless you have some very good contacts. So then that might be possible for you. But I've seen a lot of people try and not be able to get it. So GMC is something you need to get through. And next point being, it is globally recognized credential, obviously, and it enhances your prospects in other countries. I've mentioned that. Even in India, it is a well-respected degree. It's not just to get that degree, it's more about the experience that you develop with it. So this exam is not just about written or MCQ based. It is a proper Viva OSCE exam. The refraction part of it makes you do retinoscopy, makes you do refraction on different patients. You have to do your sphere refinement, cylinder refinement. It improves your retinoscopy skills. It improves diagnostic skills. So having said that, like I feel that I have become a better clinician. It is very satisfactory for me that like what I was before FRCopth and what I have become now. It's huge growth. I have lots to learn from people, from my juniors, from my colleagues. It's a lot of knowledge that you gather, not just because of this exam. I'm not saying about the syllabus, but when you study through it, you come in contact with a lot of international graduates, a lot of consultants overall. In back home in India, I got a lot of support in India as well. I'm not saying I did not. Got a lot of retinoscopy experience from my own HODs, from my departments. They were very strict, but they made me do retinoscopies, which is why I did it very well in my exam. So yeah, I am very thankful to everyone back, I mean, in home in India as well, because that is something people over there don't know. They don't even know to use a direct ophthalmoscope, which is, yeah, we know it here. So very, very helpful. And it is a respected degree in India as well. It definitely improves your CV and it is respectable. Yeah. Okay, moving on. So the eligibility criteria for this exam. So you have to have your primary medical qualification, that is your MBBS degree verified. You need not have passed your DNB or MS Ophthal or your diploma Ophthal. Okay. The right time to approach this exam is in your residency. I would say rather after your junior residency, first year of residency, you can easily, I mean, you can try for this exam right there. So there is no requirement to be able to finish your MS Ophthal. You can give it based on your MBBS degree. The only concern for international medical graduates, it is like you have to get these degrees attested, your MBBS degree. So you do not have to attest it from your UG college. You can do it from your PG college as well. That is what I did. So my UG degree, I requested my team in the PG college to attest it. So there is a letter that you have to get it printed, take the signature of the dean, also on take the attestation on your MBS degree photocopy, and you have to send it to the UK. After they verify it, they allow you to be able to appear for the exam or apply for the exam. Otherwise, it is you won't see it in your account. So first, the most important step first you have to do is that you have to open your account with the RCOFT, do this degree attestation, send it to UK digitally as well as the hard copy, and they get back to you. You have access to your account then, the exam account basically. So you can book your exam from there onwards. So now what I want to say is initially the exams had to be given in a certain sequence. Like you had to give your part one first, then your refraction, then your part two written, then part two orals. But now that thing has been taken off, you can give the first three exams in any sequence. You can give part one first, refraction first, or your part two written first. The only thing which you have to keep in mind that part two orals requires all three exams to be finished to be able to appear. So first three exams can be given in any order. So do it according to how comfortable you are. So supposedly you are in your third year and you're very well versed with your refractions, your retinoscopies. You go for refraction first. That's all right. So it's individual. You do what suits you. But from my personal experience, let me tell you that it is actually right to go in the sequence which they had prescribed earlier, because I have seen a lot of people who try to give it in different sequences, not find that much success. If you go in a proper route, because that is how they have planned it, and the difficulty levels are also similar. So the first, I'll definitely tell you about all the papers, how the exams are there, obviously. But my personal experience, my personal advice is that it would be better if you still go with part one first, refraction second, part two written third, and orals obviously is the last one. Okay, moving on. So English language point I have added here simply because I have seen that a lot of candidates they hurry up with giving the English exams like proficiency exams, so IELTS and OET, medical OET. Make sure you give the right exam and don't waste your money. You don't need you need the medical OET, okay? And IELTS, obviously. So do not hurry giving these exams because the validity for these exams is 2 years to 3 years. What I know of the last updated knowledge that I have is 2 years. So do not hurry. I would suggest give these exams, English exams, towards the end, like when you're coming close to your FRC of. So if you've done your first three exams and you're just left with your orals, might go for it. Or do it after orals, that's fine, because English exams are not that difficult, but they're not that easy. They're expensive. You can't afford to fail them. That's not the point. I mean, there's no point in failing these exams because they're we can do it. Come on. So definitely important. But again, IELTS and OET exam only for those who want to go to the UK, who want the GMC registration. If you just want FRC as a degree and you want to continue in India, you do not need to give the exam. Okay, you do not need to give the English exam. So this is only for those people who want to go for the GMC. Why I put this point is also because I people think that FRC oft will give you GMC directly. No, GMC has 4 5 criterias. One of them is FRC oft in that for ophthalmologists, and another criteria, one of them is English exams. So that is important there. Yes, so that was it. Okay, this is exam structure overview. So this is how the exams are divided. Part one, written, part two, refraction certificate, then part two written and part two orals. So part one written has your 180 MCQs. You have to choose a single best answer and there's no negative marking. It's an online exam held worldwide. And refraction certificate is a 10 station OSCE exam. So it's an in-person exam. You have to attend it in a center. There are stations, you have to do 60% of it is retinoscopy, some part of it is refraction. I'll obviously explain it in the further slides. But one thing is that these exams are available in India also. Okay. I have given both my refraction and oral exams in the UK. Now I'll just give you my personal bit of information here. What I did is I tried to see the analysis and the reports of the exams that were conducted, and I realized that the passing percentage was slightly higher for the UK based exams. In India, it was like out of 20, there are only 20 seats. That is one drawback. Like there are less seats. So sometimes you might miss the booking. Okay. Second is out of 20, only 5 people are passing, 5 to 6. That's sad. So there could be that passing percentage is bad because we are not that trained for the UK system. Maybe that is one of the reasons, or maybe other things which might be additioning. We don't get those courses in India. We get those courses in the UK. But as as the years pass by, I would say the courses are available online also. So it's not required that you go to the UK and give the exam. You can give it in India as well. The only concern you have to be aware of that there are less seats. There are 20 seats and the exam is expensive compared to the UK exam. So I've added that as well into this presentation. I'll show that to you as well. So part one and part two written, you have to give it in the comfort of your home. So do not get misguided by that. When I say comfort of your home, it's actually not that convenient. So giving the exam in the centers, like we have given our NEET exams, we find that it's difficult to travel and all those things are there. So, but yes, when I thought that, oh wow, it's in the comfort of my home, I have my own laptop, I'll sit in. No, it's not that comfortable. It's not that easy. You need to have the right internet speed. You have to have your different webcams. You need to have your proctored online app. So I'm not saying it's difficult. I'm just saying that don't get misguided that it's very online and comfortable and this and that. It's not. So just be, if you're giving the exam, make sure that you talk to one of the seniors. Just make sure you go through the guidelines, you set up the system beforehand. There are people have lost connection. Those things do happen, it happens in every exam, but be prepared. These exams are held in the comfort of your home. They do not hold these exams in the center. So you will have to make sure that you have good internet connection. So do it in your hostel room, in your proper meeting room if you have one. You will not be allowed to get up in your exam. No washroom breaks or nothing at all. Water bottle is allowed. So all of those things are there, but you have to make sure that there's no disturbance, noise disturbance, and all of that. You have to take care of that. Yeah. All right, moving on. Okay, so this is I've segregated the slides into different exams. Step 1, 2, 3, and 4. So part 1, FRC of written exam. This is the percentage that I've added. That is 50% passing rate. So in my time where I gave my exam, that is I gave in 22. I gave it in October 22. The passing rate was 62 to 65 percentage. The last recent most percentage which I checked, I updated this percentages according to the recent reports. So it's 50%. So this is definitely not the easy exam. And believe me, out of all the 4 steps, this is the toughest exam to clear. Okay. This is what is the general consensus, that part 1 FRC off is the toughest exam. But after giving part 2 FRC off, I realized that it is even tougher. So, okay. Coming back to part 1, 50% passing is not that, yeah, you have to be very well prepared. But those who give FICO, for them, it's good because you've already gone through FICO, you know the syllabus. It's the same syllabus, basic sciences and optics. So optics, you have to read Elkington for optics. Basic sciences, you have to read the not Oxford handbook, but the book by Oxford training. So that's your basic science for ophthalmology. People who have done John Ferris, I know that some people we used to do John Ferris MCQ book for FICO. So even that is a good book. You can do that as well. But you not need to miss these books. So the books that I've added here are something which everyone is doing. So you cannot not do these books. Do that, okay? Similarly, I've mentioned there are 180 MCQs, 2 MCQ papers, 90 MCQs each, and there's a 1 hour break between 2 papers. So that 1 hour break, you can go out, you can have your lunch, you can come back. So exam starts at 10 a.m. Indian Standard Time. So every location starts at 10 a.m., be it in any country, okay? So delivery is online and it is open to all candidates. Maximum attempts you can do is 6 attempts and there's no negative marking, right? And then the next paper is your next exam is your refraction certificate. This exam has a passing rate of 78%. But again, this passing percentage is the UK exam, not the Indian exam. And the exam is divided into 10 stations. So 6 stations are based on retinoscopy. 4 stations have a model eye. And 2 retinoscopy stations out of 6 retinoscopy has a patient whose eyes are undilated. So you have to do an undilated retinoscopy, okay? And it is not just doing retinoscopy, you have to even reduce the refraction from it. So give a spherical refinement, or sorry, not refinement. You have to get the refraction and you have to fit it into the iPad, in 10 minutes. So in 10 minutes, you're supposed to do retinoscopy of 2 eyes and enter it into the iPad after doing your distance conversion and subtracting dry retinoscopy. It's all dry, it's not dilated, so dry retinoscopy, but you have to subtract the distance accordingly and add it into the iPad. If you don't add into the iPad, you lose the station. What happened for me is the refraction 40%, that is 4 stations in refraction. So 1 station is sphere refinement, other is cylinder refinement. Third is your binocular balancing. And the 4th station is your forcimetry, that is, I think, lensometer. So they had kept a manual lensometer in the exam. It is always there in these exams. And unfortunately for me, I did not get access to a manual lensometer. I had never practiced on anyone. I reached out to a lot of colleagues, a lot of colleges, a lot of medical government colleges. I just couldn't, opticians even. I did not get a forcimeter. So I was really worried about how I'll do this exam. Doing an entire station without any experience, it was very tough. So what I did is I went to a lot of YouTube videos. I saw how they're doing the sphere refinement, cylinder refinement, forcimetry. In fact, even the phosimeter is not of the just one variety. You have 2 to 3 variants of phosimetry. Okay, so I just kept on seeing those videos, and there was only one hope for me. I had taken a course in the UK, in Birmingham, Optom Academy, and Shamina is an optometrist. She taught me, and she had a team as well who helped me. So I learned phosimetry in 45 minutes. Believe me. And I even did it in the exam, but I still lost the station simply because I could not add the values in my iPad, because phosimetry was clubbed with a cylinder refinement station, and cylinder refinement is really, really tough. So it has a Jackson's cross cylinder, and you have to work through Jackson's cross cylinder to be able to refine a cylinder axis and the cylinder power. So that took 1 minute extra. So I lost my time. I could not feed my answers into the iPad. That is why I lost the station. But luckily, I managed to pass the exam. So it is not that even if you lose one station, you'll fail the exam. No. Retinoscopy, I was able to do it. I was good at retinoscopy because my HOD made sure that I did a lot of pediatric cases in my PG college, in my senior residency. Also, I had a wonderful support. So I did the retinoscopies, which helped me. Actually, it did help me a lot. But still, they refined it and they gave me some tips and tricks to be able to do it faster, how to calculate it faster. So that is something which, yeah, I learned from them. So yeah, you have to just practice about it. And once you book the exam, you will get access to the links of the exam sheet, how the exam sheet is there in the iPad. So you can practice feeding it. Everything is available. You just have to avail it and make the best use of it. You even have the, I think, American Academy of Ophthalmology has a simulator, retinoscopy simulator. You can try that as well. I know it's outdated. People don't do simulate retinoscopy, but it is not outdated. Believe me, pediatric patients do require retinoscopy. Do not take it lightly. It's very important. Okay. And once you go into your clinical setup, it's important. Don't just rely on your optometrist. Obviously, you should be able to refine what they are doing as well. Make sure that they are doing it correctly and your patients benefit from it. And okay, love your retinoscope always. So I bought a kilo retinoscope. I also bought a model eye. I bought a local version in India. I did not buy the Heinz one. The exam has Heinz model eye, which is actually very good, but it is very expensive. So I not put much money into it. I was doing a lot of retinoscopy in my OPDs and government institute. But then I still bought the model eye, the local one in India, and I was practicing on it. And then I gave it to my seniors and my juniors. So if you don't want to buy it, you can just take it secondhand from a senior or just share it amongst your friends or colleagues who are sitting the similar exam. That is doable. Okay. And you do need you do only have 6 attempts at this exam. So I'm not trying to scare you guys. It is very much doable. I did this exam in my first attempt in UK, so it was difficult. I mean, going in a different country, talking to the patients in their language. We do have a little language problem once we go there because they speak in a different, they have a different accent, so it becomes a little difficult, but it is not doable. So you guys can definitely do it. It's just that don't take it lightly that, okay, it's only retinoscopy, I'll do it. No, it's not like you have to give justice to the exam. You have to prepare well. Okay, that's it. Okay, next step is your part 2 written FRCopth. For me, this was my toughest exam because I did not clear it in the first attempt. All my other exams, I made it through in the first attempt. For me, I lost the first exam by 4 marks. So I had to give it more than once. And so the passing rate, it's 79%. This is the current passing rate. This is the latest, which my exam had 79%, which is quite good. I'm surprised because the previous exam, which I had not been able to make, it was just 670 or something, 70%. But I don't want to mislead you guys. Please don't get misled by seeing the 79%. Because if you see the part one, usually people come here in the third step. So you understand the level of the students that are coming to give this exam. The first exam has already taken off 50%. The refraction exam takes out another 20%. And what you see here is the very cream people, okay? So do not take this lightly. this is one of the best exams, the toughest exams, which I realized some flaws about myself. I took this exam early. I realized that I should have prepared much better. I was a little overconfident. I gave this exam only in 1.5 months preparation, which was very bad. That is why I did not make it. So I'm trying to learn. I did learn from a mistake. I took proper time. I took a gap. I did the exam after almost a year and I did it very well. And I passed it with a good score recently. So, and only 4 attempts are allowed in this exam. So please do the Oxford. This book is the Bible. You have to do Oxford Handbook. Indian students usually do Kansky, which is also good. I have seen a lot of people pass with just doing Kansky, so it's very much doable. The only thing I said is do Oxford Handbook is because the exam they literally have lines picked up from Oxford Handbook, and believe me, this is a very good book. Like I did not know it and until I did it. And yeah, I actually I can say that I think I improved my knowledge about clinical ophthalmology after doing this exam, this part especially. So very much important. And these are just the books. You also need to do Q banks and everything. So if I do an individual video on each exam or an individual presentation on each exam, I can delve more into it. But since we are doing it an entire, I'm telling you about each part steps right now, so not go much into depth. But if you guys want to reach out for any further information, feel free to reach out. Okay, so moving on. This is the last exam, but this exam needs to have all the first 3 steps to be cleared to be able to give this exam. The last passing, this was, I think, the London exam, I would say, which had 77% passing. And my own result is awaited. I gave this exam in April this month in Cardiff. And it was a very wonderful experience, I would say. Yes, I got a lot of information. I attended courses in the UK, not just UK, I attended Indian courses as well. I would not say Indian courses. What I said, I mean, by Indian, I meant that I had a group of Indian friends with who I was studying. And we used to do a lot of interactive study sessions with Indian group, with international friends, and I did get to learn a lot. And it's a very enriching experience, I would say that. So very important to, and this is a Viva and OSCE station. So here you have to, it's based on clinical judgment, your comms, how well you talk to the patient, the counseling. So it's not like how we do it in India. But the private practices definitely has given you that exposure about how you want to talk to the patient. But there's a here they will delve more on the UK based guidelines as well. So the Viva part of it has some UK based guidelines and some UK based NICE guidelines or driving license guidelines. So you need to be aware of certain things. I know it's unfair, I would say, because it's FRCopth is taken by lots of candidates internationally. But since it's a UK based exam, you just take it with a pinch of salt. You have to prepare a little bit about UK based exam as well. That is one of the drawback of this exam. So yes, and attempts are only 4, and this is the last exam. This exam actually gives you the FRCopth degree. Okay. Passing rate is 77%, quite good, but if you see, it's not that easy. And that is also that was 77% was also the UK-based exam passing rate. In India, the recent Mumbai exam had only 5 candidates passed out of 20. So yeah, Indian exams, I think they are a little tough, or I would say the passing rates are down for India. And in fact, other countries as well, Dubai also lower passing rate, yeah. All right, so this is the examination fees. It's 2025. I've taken it from the website. What I would want to mention is that RCOF does update the exam fees. So do not keep thinking about taking this exam because the exam fees they change every year. Okay, they always increase. We know that. So take the exam as early as possible, but not obviously have your timelines in consideration. And so part 1 is 72,000, refraction is 72,000, but this is the UK based rate, okay? When you come to India, it goes up to 900 pounds or something, or even 1,000 pounds. So you have to prepare for that. Part 2 written, part 2 orals. If you see written, again, it's at your home in online exam, 72,000. but this tends to increase with time. So please, I mean, keep that in consideration, and please check the website before planning your exams, okay? Part 2 orals in UK is 1,24,000 and part 2 orals in India is 2,38,000. This is difference. This is the difference, okay? So refraction, also the difference is there. I have not added the India version of the amount. So my own thinking was to give the exam in the UK was that passing rate was better. The money was less. So I was like, why to spend much money in India and have higher chances of failing? So I personally thought that if I go to the UK, I get to do those courses there. I get to experience UK and I have a higher passing rate, chances of passing. So that was my thinking, but it's all right. You can still give the exam in India. I have a lot of colleagues who have passed Indian exams as well. Okay, if you want, I'll give you those contacts. I mean, that's possible. So I'm sure you guys must be knowing people who are given the exams in India who have passed as well. So not demotivating you guys, definitely. But yeah, this is something to be considered, to be keep into consideration. Yeah. Okay. So estimated timeline, part 1 is 4 to 6 months. This is very important because sometimes we get overconfident, like I did. I gave my refraction exam in September and I sat my part written in December, like only 2 months gap. It was very less time. So uh, please give time for your part 1 preparation. For me, I sat my part 1 in August after my June exam in university exams. Sorry, I started my preparation in August and gave the exam in October 22. So what I mean to say is, if you have given your recent university exams or if you have given your recent FICO exams, then this duration can be only 2 months or 3 months. That's fine, okay? So if you have given your FICO university exams, it's all right. You can still give your part 1 exam in 2 to 3 months because the syllabus is the same, okay? Refractive for people who do not know retinoscopy, who have never done retinoscopy. So to develop the skills, it takes time to be able to do it regularly. People who are well versed with retinoscopy, you can prepare the exam and give it within 1 month, like doing refractions regularly. Do go out. Do go in your OPD. Do not just put a refraction for your juniors or optometrists. Go out. Do it yourself. You wouldn't get the feel until you do it yourself. And believe me, it's an entirely different experience and it gives you an immense amount of confidence if you're able to do a refraction perfectly. It's wonderful. So do it. If you're giving this exam, do it by yourself, and that definitely helps you. And if you're experienced in retinoscopy, 1 month is enough. Otherwise, 3 to 4 months you have to take out for your refraction exam. Part 2 written, hands down, you need 6 to 8 months. Again, this is something subjective. For me, after I failed my exam, I took a gap and I prepared my exam in 4 months' time for part 2 written. Some people can do it in 6 months. It's an individual thing, but if you are not confident, then you need to take 6 to 8 months. Otherwise, you can give it in 3 to 4 months time. I have done it, and it's doable. But then the passing is a problem. So just assess it yourself, okay? Then part 2 orals is 2 to 3 months. I would suggest for candidates who pass part 2 written, do not take a break for part 2 orals because subject and the concept is similar, the syllabus is similar. Only thing is oral is more about practicing, more about diagnosing. So it's doable in 2 to 3 months. And the best time to take orals is right after you pass a written exam. So do not do not make the mistake of taking gap between written and oral because written will have taken a lot of your efforts. So make sure that you use this efforts for the oral exam as well. Okay, do not take a gap here. That's what I'm saying. So total duration is 15 to 21 months. That's something you can keep in mind. It may be early, a little early, but it's subjective. Okay, subjective, and depends on whether you pass the exam in first attempt or not. So just keep that factor in mind and plan accordingly. And okay, benefits. So of doing this exam is you have a professional recognition. Obviously, it helps you better career opportunities. You do get. Getting GMC in the UK definitely opens your options to fellowships in the UK. So FICO, the problem with FICO was for my because I also wanted to do that. I started it myself. I realized that it does not give me GMC. The fellowships that I would be getting would be short term, like 3 months, 6 months. And also, the country may or may not be of my choice. And like eventually I'll have to come back to India. So I was not at freedom of choosing the fellowship of my choice, or sometimes if you're rejected by a fellowship by FICU, then you do not get a second chance. So that was also there. And I realized that some European countries have literally given off with FICU. They have scrapped it, like they don't consider it anymore. And like FICO through getting FRCS Glasgow through FICO route had scrapped completely. It was not giving you GMC anymore. So that was the reason why I thought of shifting to FRCO entirely, because it directly gives me GMC registration. So that was my consideration about going ahead with it. And skill enhancement, as I've already mentioned, your knowledge and your personal skills definitely improve, because orals exam you need to be able to do, confrontation skills. You do a lot of fundoscopy or in-depth ophthalmoscopy. We take things lightly, but when we do it in the exam, we learn it the right way. How is it exactly done, using prism bars? So it's a holistic thing. Moving on, challenges, financial investment, you've seen that, preparation demands, timelines, travel requirements, and cultural adaptation. Why I said this is because your GMC guidelines are something which UK exam do test you on. So that is something you have to adapt yourself about. So that is one thing which is a drawback, but you have to keep that into consideration. And what my suggestion is, if you want to do it, if Indian students, they do Kanski. So if you're doing it, please continue it. But what I have already mentioned, these are must-do books. So please consider that as well. And do Chua's FRCopth series. You have practical OSCEs and ophthalmology available on the websites. And the go-to website is your RCopth website. Like hands down, it's the website. It has everything on it. And online question banks and forums, do be a part of it. Most important thing I want to add here, I've added here as well. Study groups. You need to have a peer group. You need to have a study group, like-minded people who are going for this exam. It's wonderful to have them, and it just changes your chances of getting through the exam by many times. So that is my suggestion, because you learn a lot. And my personal experience, I'll tell you, clinical peanuts. I joined clinical peanuts. I joined clinical peanuts simply because I wanted to learn from it, and it's a wonderful community. So those, I mean, I know a lot of people are already on the program here. So make the best use of it. Okay, be a part, because so keeps wonderful vignettes. And I had one of the vignette which Sir had kept. So it was a tuberculous patient, serpiginous choroiditis. So I had that in my exam, and I was remembering, oh wow, I've done that with him. So believe me, in actual exam, it is going to help you a lot. So I cannot emphasize this enough. Sorry?
No, go ahead.
Okay, sorry. So yeah, be a part of this group and make the best use of it. You guys, all of us are lucky, I would say that. So that's there. And tips for success, you have a structured study plan. Put your head down, work ahead. Nothing else can beat. It's not that a cream person or a very smart person has to get through the exam. No. It's doable by any average student. I am an average student and I've done it. Believe me, it's very much doable. The only thing, you have to have a very smart approach. Don't hurry with the exams. Think through, have a good peer group, do mock exams, stay updated. Is why I say stay updated here, is because how I planned my peer group was, I took everyone from a different stream. Like one was a retina person, one was a cornea person, one was a glaucoma person, one was a uveitis person. Okay, so that's how I made my own group. So everyone is updated in their own stream. So like in my exam, like tackle plan was asked. So that's a recent drug. Okay, so you need to be updated. You might not be updated in your stream, but if you have a group where people are from different streams, they are all very well updated. So that's how you get updated about everything else around you. So that is very important as an ophthalmologist. So that is definitely in the exam. Yeah, it's crucial. And it's good also. It gives a very nice impression and for the examiner that if you're updated. So that is important. And you have a lot of mock exams available. So that is doable. And yes, the floor is open for any further questions. And this is my contact detail and additional resources like iAcademy, Ophthalmology. These are resources. iDocs is a little outdated one. So do not invest into it right away. Just think through, go through all the other Q banks, see the amount of MCQs they offer. iAcademy is the closest to the exam. Okay, and it is created by three trainees in the UK. They are now ST5, ST7 trainees. They have done their exams. So wonderful attempt by Academy. So that is very important. The cost is around £300. So that is it. And off the queue is the one which is created by the US because a lot of US candidates, Mexican people, South America, or international candidates, they too take these exams. So Ophthalmology also has FRC of subscription, okay? But it is very expensive, around £500 for 6 months. But it is hands down the best question bank. There is nothing about it. You learn a lot, like nothing about it. Nothing negative about it to say. Off the bank is a cheaper one. It costs around £50. The last which I saw at £50. And they also have, excuse me, sorry. So they also have around 300 MCQs and they are also very, very close to the exam. So if you have to choose between iAcademy and Off the Bank, iAcademy is £300, Off the Bank is £50. And both are closest to the exam. Okay, so I personally did all of them literally. And I did all the MCQs at least twice. I also subscribed to iDocs, but I realized that it is not worth it. It's my personal opinion because they have some wrong answers and they have some it's outdated. So I mean outdated is also we can adjust, but if the answers are wrong, you end up learning something wrong. So that is pulls you down. I don't want that, which is why I'm referring that do not, but they have really good forums which are free to join. So go there, see how people are doing these exams. People write their views into it, like how their exam was, what was asked there. Okay, so it's very good forum. So you go there, you see it. But if you want to do the MCQs, just I would say think again. Okay. Rev Eisen Conquer is by Dr. Mustafa Dovidar. I attended his oral session. It's an international online platform to be able to do oral viva OSCE preparation. Sir is also coming up with FRC of part 1 section this year. I cannot say much about it, but I did have some good information and experience with orals exam. So that is also one of the considerations if you would like to consider. And I mean, if you guys have any further queries, feel free to reach out. I'm here to help. And yeah, that's about it. Any further questions? I'm up for it.
Okay, thank you, Dr. Emali. That was really wonderful. I think where you have chalked out the entire journey and putting your personal experience, that is yeah, because we can find the information, but how to go about, and that really helps. I think I'll only go ahead with the first question.
Mhm.
Like for this retinoscopy, uh, do you feel that are there any separate textbooks? Like because retinoscopy for us is just a thing which we from learn from hearsay. So
Mhm.
is there any books for the technique, or is there difference in what we learn in our medical college or as postgraduates? Is there any difference?
Yes. This thing to do retinoscopy, the technique is similar. I did put a book into that Master Pass by Refraction. I put it in the slide there. So that is the book for it. So do give it a read. But the best way to learn retinoscopy is from your seniors. I would say the senior consultants who have done retinoscopy in their time, they are
Right.
the best people to guide you. Okay. So I really had I had the hold of retinoscopy before I attempted the exam, even before I did the course in the UK. The only thing which they guided me was that my arm distance was something which was not exactly correct. So they just measured it and they just showed me, like what they taught me was to while looking for the axis, always bring the bar down so that your streak is the thickest
Right.
to be able to locate the axis. Because here what I had learned was keep it in middle, just somewhere a little bit lower but not entirely down, and you do a retinoscopy based on that, using that streak. Fine, you have to do the retinoscopy on that streak only. But what I learned in UK was they put it entirely down. They make the streak thickest. They see the when the reflex is in that direction, so that it's better located, and then they reflect that reflex on the wall, where you have a protractor in a big, huge protractor
Okay.
pasted on the wall. You throw the streak over there, you see the axis, and then you directly subtract 180 degrees or 90 degrees, and then you align it, calculate it beforehand only. Put the streak in. Don't look for the another axis by doing retinoscopy. You only look one axis in the retinoscopy, the thickest one, and then by making the thickest streak, and then you subtract that, put it in a reverse, opposite axis, and do the refraction in that axis, and that is the fastest way to go about.
Yeah.
And they use a cross, which we use in India as well. So they
Right.
use cross. Cross is the right method to go about, and then subtract only one axis, like the minus one, the axis which is minus, cylinder axis, which is the minus value. Only that they used to work on. They only
Okay.
subtract from one axis. They don't get confused. They remember only one thing, and they put it into the field. So that's what I learned from them, how to do it fast. And they used to time me as well.
Okay.
So almost 2 hours of retinoscopy I did 3 days before my exam, and I sailed through in the exams. So it's more about practice, yeah.
Yeah. I think that is a very interesting point which you told of keeping the beam thicker.
Yeah, it just gives you a better idea about the axis, you know. Just be smart about
Maybe
it.
next time all of us will try and have, and then most of the patients which we are going to do retinoscopy are going to be a case of regular astigmatism. So
Yeah.
we can get the other axis. We don't need to find out just by subtracting. So
Yeah, but in the exam they had weird axis like 135,
okay.
75.
So mean that we need to be vast in calculation as well.
Yeah. But then that also they taught me, like, just don't even think about it. Just put 135, just rotate it by 90 degrees and see where it is landing. So I was not even calculating anything.
Okay.
Yeah. I was just rotating by 90 degrees and 180 degrees. That's it.
So I
Yeah.
think I think we have a question. Dr. Aisha, are you there? You can use the mic.
Yes, I'm here.
Yeah, please go ahead.
Hello, I'm Dr. Aisha from Pakistan. I'm a second year resident here in ophthalmology.
Mhm.
I'm about to appear in the refraction certificate exam, which is going to be held on 26th of May.
Mhm.
Uh, I wanted to ask that I am practicing the retinoscopy
Mhm.
on the model I hindly. And at first, I had a lot of confusion regarding the cylindrical values when I was putting the cylinder. But then, thankfully, I read the Master Pass book. It was pretty helpful. It guided me about the axis, which I was getting
Mhm.
confused about. But one thing I'm still confused about is that there are two formats to calculate the
Yes.
prescription, right? Like one is the power cross and the other is the
Yes.
spherocylinder format. And we can choose either of the one in
Yes.
the exam, right? So over here in Pakistan, what we do is that when we are calculating the power cross, we are first calculating the gross retinoscopy without the working distance, and then we calculate it with the subtracting the working distance, right? What I'm confused about is that we subtract the working distance from both the axes in the power cross. Is that correct? Because when we take out the final prescription, then we do the other calculation and we take out the power of the cylinder. Um, मतलब इसमें कुछ ऐसा तो नहीं हो जाएगा like
So
mod-
let me tell you. So I took this course with Shamina. If you heard, she's also from Pakistan. She has she in Optum Academy basically, uh,
okay,
in the UK in Birmingham. I had given the exam in Birmingham. Are you giving the Birmingham exam 26th May, or
right?
it's in Pakistan? It's in Birmingham, right?
No, it's in Pakistan,
All right, because there's a Birmingham exam also in May. Anyway,
right?
coming back to your question, yes, Dr. Aisha. So, what I would suggest is what I was also told by by the course there, that in
Hmm.
the exam, like you do when you do the retinoscopy, you do the power cross, you put
Right.
it in ferrocylinder format, subtract
Yeah.
only one value from it, and enter the answer in the spherocylinder format, because in the iPad, the sheet that you'll get in the exam, it'll have
Right,
both options. You'll also have a power cross. You will also have the option to attend answer it in the cylinder format, in the
right.
spherocylinder format. Okay. But going into the power cross format, it'll take a lot of time. You might have to scroll through the value. Okay, so do not attempt a power cross, because I have seen those who tried the power cross method, they were not able to finish the exam. They lost the stations because they could not finish adding before the system closed. Okay,
Okay,
power cross will
right,
take
right,
time. So solve the power cross on the paper. You will have the paper available, but
right,
into the answer sheet, convert it into spherocylinder format and then enter it. All right, and
all
only
right,
one value has to be subtracted from it. So
all right,
beforehand only you convert it into spherocylinder format, then you add your working distance, and you subtract the working distance and then add your final prescription. That's how to go about it. That's the fastest way to go through the exam. Yeah.
right, right.
Yeah.
Also, it is said in the instructions that we will not be given the trial frames will not be used on the model eye, right?
Yes.
So, will we be given protractors to see
Yes.
the
Yes.
axis?
Protractors will be there on the wall. Absolutely.
They will
And
be beside the wall.
on the wall, in the exam center, wherever the exam is there, the wall will have a protractor pasted on it. Yeah.
All right, all right. And a few more questions. I'm sorry if I'm not taking much time. So
That's
in the subjective refraction, the sphere, will we be given a very high number or will it be
Depends.
variable?
Entirely depends on what patients they get. So
Oh, okay.
yeah. I had minus 5.75 with some minus 0.75 cylinder and weird cylinders. It was in the UK, but it was they do keep it different. And the model I will be one will be plus, one will be minus, but that's entirely subjective. Like it
Right,
depends on the examiner also. But you can expect anything in the exam.
right.
And one thing I personally wanted to suggest is use those I remember which we had you remember we get those lenses in the block, like multiple lenses in a block. You can use that.
Yes, yes, the
I don't know what
rect
is it called. I think I
rack. It's
rack, the
called the
lens
rack.
rack. Yes. I
Yeah.
given it to one of my colleagues for the exam. So use a lens rack. It's very faster to get. Taking a lens from the rack and doing single solitude. No, you go for a lens rack. You fine tune your refraction, and then you come to a gross refraction power, and then you fine tune it. So use
All
a lens
right.
rack to come. Yeah, that is very important. Okay, you do that.
Okay. Thank
Yeah.
you so much. Last question. In the Fossimetry station, in the iPad demo, it is written that in the for the prism part that we should place the right spectacle lens and we should calculate the left prism. I did not understand this at all. If
No,
you,
actually, no, it's not like that. Any amount of prism is applied for both the eyes. So
yeah,
just a quick tip. If you get, for me, it was very silly. I tried to look at the other glass as well, but then I forgot about the tip myself that I'm suggesting right now. So if you get a prism, you confirm it, but it is obviously going to be the same prism in the other eye as well.
all right.
Make sure you
Thank
have
you
the
so
base up,
much.
base down, base in, base out. And it is
Yeah,
easy. It's just that you need to have one shot at the proper Fossimeter and you're good to go. It's like not that difficult. But make sure
all
you
right.
put in the values on time.
In the iPad, yeah.
Yeah.
Thank you so much. Thank you, Dr. Emali.
No worries.
Thank
You're
you.
most welcome.
I think that lens rack I think it's good for even practice also.
Yeah, it's actually very good because when I was prepared for my refraction and I was allotted some patients like, okay, do these many, and like I was also doing it with my colleagues, and my colleagues were wondering how are you finishing your patients so fast. I'm like, okay, that's the trick. You get a gross refraction very quick, very quick. It's +7 plus minus everything is in one rack, so it was very easy for me.
Yeah,
Yeah.
and I think it's
And in
not
fact, I did the
expensive
stations with
also.
one minute in hand. Like I had 1 minute spare in the exam, so for me to check the exam answers, and which was lucky. I was lucky in that matter because one of the questions I had one of the things okay I can say now is that by default the exam has plus it puts plus sign by default. So if you have a minus refraction, make sure that you put the minus sign. So I had forgotten it, but luckily I had 1 minute to spare in my exam. So I got a chance to check my answer, which is when I realized that, okay, this is a minus, and I, by default, the iPad puts plus sign. So you have to be aware and put the minus sign, otherwise you lose the station again. So it's tricky, but yeah.
I think we have one more question.
Okay.
Let's see whether Dr. Aung, can you go ahead with the question? You can use the mic.
Hello.
Hello.
First
Yeah.
of all, thank you for your presentation. So just want to know, can I know how to practice manual forcimeter, because in examination it's difficult to finish in time.
Absolutely.
We have to do for both eyes, right, in the examination.
Yes. It is difficult. I can agree on that. The question is, that was my weakest point in the exam. So to counter it, what I did is I saw a lot of YouTube videos. I literally used to see one video every night for forcimetry for last 15 to 20 days of my before my exam, to just fix it in my mind about how to go for it, because I did not have an access to a forcimeter, like never. So doing a lot of videos, and then I got this course with, so if you don't have to do a course with some person. What I'm saying is, if you are able to get access to a forcimeter from your senior consultants or from your opticians, just go there, spend some 45 minutes with them, take different varieties of spectacles, glasses, and do it yourself. Unless you do it yourself, it's not going to be that smooth. Also, in the exam, you have to go, at least I would suggest, go 1.5 to 2 hours prior. Okay. Reason being, they do keep the forcimeter outside the center for you to be able to get used to it. Every exam center has a forcimeter outside kept. So you get to get used to the version which is there inside, because forcimeters do come in different variants, and everyone not might have been exposed to that version of the forcimeter. So in spite of me learning with Shamina, the Optum Academy, the forcimeter in my exam was entirely different. But because I'd seen a lot of YouTube videos, I was able to navigate it. And there are people, they do keep glasses over there, and they keep the refraction prescription over there for us to practice and to get the idea and the feel of it. So go a little bit ahead, in the exam, so you get the time, because there are other candidates as well who want to take, and there's only one forcimeter kept out. So you have around 10, 15 candidates who want to all do the forcimeter. So my point was, go 1 to 2 hours prior. It's all right if you have to go early, but at least you get the experience of the forcimeter there itself. So yeah.
Thank you. One more question, please.
Yeah, sure.
Can you please tell me more about the oral exam experience? I heard that the oral component is very difficult. Did they ask about the latest or the advanced cases, advanced technology, advanced cases, or did they ask about trial or the any view?
Yes. See, they don't ask everything about the advanced trials. They do ask about trials. One entire station is based on the trials. So, in my own residency or my entire ophthalmology career back in India, I never emphasized so much on trials. But now, after doing these exams, I know all the trials at the back of my hand. Like I can, like, just start and go on and on about it. So you do get to learn about everything, ARMD, you get to learn about diabetic, DMO, your pedic studies, your whatnot studies you get to know about. So it's a cultural, I mean, I would not say cultural, sorry, that was the wrong word. I would say a lot of consolidation is the right word to go for it, about the subject you get and how to approach the treatment from that. That is how our treatment has been devised over the years. These trials have helped us, like optic neuritis ONTT trial just changed the dynamics. It was steroids which we used to give previously, like oral steroids left, right, and center. But ONTT was the one which changed the dynamics of it entirely. So these trials are very important. So they don't ask something out of the blue. They will ask you basic stuff, but like they will, like glaucoma, there are 15 trials which I never thought I would ever remember. But now I do understand what was the outcome. And now if I have to treat a patient, okay, I'll think, okay, NTG has this 30% reduction in IOP. This was used. That was the logic behind doing treating an NTG patient. So these are all important things which you develop. So do not get worried about the orals exam. It is very enriching experience. It was a very tough exam. It was a very tough exam. I will not deny that. But it was very good. I did not know things about myself which I got to know from this exam. So it is doable exam. So do not get worried about it. Everyone is in the same phase, and yeah, there's a good community out there. If once you get through the steps, you will meet a lot of people who are there in the same scenario as you, and you will get a lot of company and develop together. Yeah.
Thank you, madam.
Yeah, I think that's a very important point that studies are like we don't need to know everything of what was
Yeah.
how many participants were there or like, but we need to know the gist of it because our treatment is derived from that. It's why we are treating and how we are treating is very important. So landmark trials as like
Yeah.
glaucoma or even retina or any subject are definitely very important. And as you
Yeah. And
see, the newer studies which you can get away if they are not very landmark, they are not very important. If you know good enough, if you don't know, it may not be important. I think that's. Do we have any other question? Because Dr. Emali has been taking sessions throughout, and she was very yeah, in taking another session for us because we had a session last week. So how long you're here now?
I am here till I find something. I do have an observership opportunity, but it'll take some time. So I'm waiting for my results. Once I get my results, I'll apply for GMC, and then I have spoken to people. I might get a job there, but the only concern is getting GMC. So once I get my FRC off, you get GMC, and then you're able to go through. So in the meanwhile, I'm here.
So we can, I think, catch hold of Dr. Emali for some more
Yes.
sessions as long as.
Ma'am,
Yes,
is,
sure. Yeah.
is the part two oral exam, the Viva for the part two, is it
Mhm.
only conducted in the UK or is it also conducted in our own countries?
No, in all countries as well. The only concern is that the seats are less, 20, in every country where they're conducted. The price is almost double, and the passing rates are not that very good. I mean, that's what I have. Maybe it's a lot of reasons there, but yeah, but it's doable in, I mean, if I think in the future, like in my time, it was very difficult to get through these exams in India, but now though it's like you can definitely get it in your own country as well. Yeah, yeah. So the consultants fly in from the UK, by the way. They fly in from the UK, they conduct the exam. You get international consultants as well. You get your own Indian consultants. Everyone is there in the exam. The one thing I want to say, the Mumbai refraction exam was they did not have a forcing meter working. So it was very sad and very difficult for the candidates because they were really very worried about it in the exam. The forcing meter wasn't working in the exam as well. So like it's very difficult. So I obviously in the future they will make sure that things are working and check before the exam is conducted. But yeah, getting a forcing meter in India for me, I don't know why it was so difficult. I reached out a lot of people, but I couldn't get it. So if you could get it, just yeah, do that.
I think LV Prasad has a very nice culture because
Yes.
there, I think auto refractometer is totally like as a resident, you don't get to see AR.
It should
So,
be that way, I feel. I mean, at
and
least when we are learning, at least when we are growing.
yeah, because the residents who come out from there, then they're totally surprised that oh, it's so quick and you have actually something. Because till then it feels like it is only there in the books that there is a auto refractometer and it is something a redundant or some technology which is too advanced maybe.
Yes.
I think
My PG college, my head of department was very strict. He would not allow us into the auto ref room. We were not allowed. We had to do everything but retinoscopy, and that's how I developed my skills. So I'm thankful to him.
I think we have one more question. Dr. Shubham, you want to?
Hello, sir. Hello, ma'am.
Yeah,
Hello.
please go
Hi,
ahead.
Shobhit.
First of all, thanks a lot, ma'am, for such a detailed and such a comprehensive and such a beautiful way you presented everything. Just a roadmap for FRC off. Ma'am, I'm currently pursuing my third year residency in Mumbai, India. So, ma'am, I have a question. Like, since you were in UK, you had an upper hand and you got to know all that environment. You were in the environment, so you were better assessment. You had that how to give exam and how to approach the patients in their language and their environment.
Yes.
So for short term goals, like suppose if I'm planning to give a first year of first part in this December,
Okay.
and third year will end after December. So I'm like, how to reach to UK for short term so that I can get into absorb into the environment and work for some time before I'm prepared enough for the further parts of the FRC off, ma'am.
If that is something you're worried about, then you have to go the PLAB route. Like you'll have to give the PLAB and get through there. Or if
I
you
mean,
have some contact, getting a dual sponsorship pathway.
okay,
But
ma'am.
it's very tough, very, very, very tough. Like believe me, I've been trying since the last 3 years. It's very difficult to get a dual sponsorship route because you need a sponsor, you need a consultant in the UK to believe in your skills. But how
Yes,
can they believe it while you're still in India? Okay.
yes, ma'am.
So why would they want to sponsor you? It's very difficult to get, and there's no streamlined approach because other branches they do have a streamlined approach. They have a matching to land them an observership. Sorry, yeah, dual sponsorship, but nothing like that is available for the ophthalm branch as of now, which is very tough. And most of the ophthalmologists I know in India have to take up the FRC of the route. So, or one more thing you can do is you can apply for observerships.
Okay, ma'am.
Observerships do cost, and lot of efforts goes into reaching out to a consultant who would be willing to offer you an observership. So you can do that. You can do an observership there, and after that you can sit the UK exam. I did not do that personally because it would have cost me a lot to do the exam, do the observership there, stay there. And while doing observership, it's not that easy to just like observe. No, in observership also, they expect you to do research work. They publish papers. They make you do everything, which is very good. Which is the benefit about it. Make the best use of the
Yes.
observership when you have. But if you are preparing for your exam as well, then it's not going to happen. For me, I had to give up my job twice. I left my job twice to do these two exams, part written and orals, because I could not sustain the amount of work that we do in here, India. The working hours that we put in, it's not humanly possible to even study for these exams. These are too high. Like the amount of dedication they require is another level entirely. So it's difficult. Since you said that you are sitting the residency, I mean, residency exam, the university exam. I mean, you're at a very good time to give the part one. That's how I did it. Like I gave my exam in university exams in 22 June, and I sat for my October 22 for part one in October 22. And then again, I got into my senior residency and I took a September 23 refraction exam. Though I took, because I was still, exactly, that's the point, while working is difficult to give these exams, but it's not doable. So, try to find gaps. Like for me, I tried to find the gap between my university and so in that gap, I try to do my FRC of part one. So I try to find gaps between two jobs. If I've left one job and if I'm going to look for the second job, I plan it in accordingly in such a way that I utilize the transition period as my exam period. So don't just read only while the exam period is there. No, you have to stay in touch with the studies. Clinical Peanuts is such a good platform. You get to stay in touch with all the diagnostics, everything. Like it's not just the diagnostic part of it. Everything is put across. Like how would you approach this patient? What are the treatment? So, I mean, make the best use of it. Don't just, okay, you've seen the photo, you've just seen the case, move on. Don't do that. Make sure you do it and discuss it with your colleagues. That's the best way to go about it. Be proactive. It's going to
Okay,
help
ma'am.
a lot. And then when you plan for your exam, then in those cases, if you're doing this regularly, then the timelines that I've put will reduce, because you're very well
Mm.
already prepared. You just need to go to the theory. So then 2 to 3 months of your gap, or maybe 1 or 2 months of your gap, if you take somewhere between two jobs, between your bond, you can easily get through one exam. Refraction, you don't need to take an off. I did my refraction while my senior residency was ongoing. What I did was I just did retinoscopies every single day. I told my HOD, give me all the cases that you can. All the pediatric cases, all difficult cases, all those kiddos not willing to look straight, and I used to do retinoscopy on those patients. So
Mm.
I put myself through that challenge. I used to do Jackson's cross cylinder. I bought one. I used to keep doing this, that. My God, it was very silly.
Mm.
My optometrists were like, "Man, what are you doing? Let us just do auto and we'll get it done." I'm like, "No, I'm going to do it." So Jackson's cross-cylinder sphere refinement, all of those things, there are different instruments which, if I get an opportunity, I'll share that also, what all stuff I use for optometry, for refraction exam. So make use of the instruments, do it yourself. So then you don't need to take time for refraction. I just took 1 week leave. I went to the UK, gave my exam, came back in 7 days.
Okay,
I
ma'am.
took the exam. So
Yeah.
refraction is doable that way. Part 2 written you can give in India again.
Hmm.
Gave
Okay,
there.
ma'am.
You can give it
Hmm.
in India as well. So that's fine.
Okay, ma'am. So, ma'am, your take is that I stay in India itself, I prepare well, and then I go to UK for exam, just for giving exam. That's right, right?
Yeah, also plan your observership accordingly. Like what happened is my observership got delayed because of Easter and everything. Otherwise, I would have stayed back. I was already in touch with my consultant, one of the consultants there. I wanted to do my observership and come back, but unfortunately, it was taking time for the process. UK is very slow, so that is the reason that I didn't want to spend much time there. Already spent 1 month there. I was missing home, so I came back.
Okay.
But
Ma'am,
yeah,
if I, yes, ma'am.
yeah,
Okay,
sure.
ma'am. Ma'am, if I want to apply for observership, do I have to look out for like on an individual basis, or is there some platform through which I can
There's
approach
no
for observership?
platform. There's no platform, to be honest. It's very,
So,
very tough. I have been applying for quite some time now. You can get definitely MoveFields has an platform like MoveFields you can apply, but it's very expensive, like 50,000 rupees, Indian
hmm,
rupees for 1 week. It's not, I mean,
yes, yes,
for
ma'am.
people it might be okay, but for me, I want to do proper observership where I learn, where I do research work, where I publish papers, because that is what I am interested in. So I want
Okay,
to do that.
okay,
I
ma'am.
just don't want to give money and put it just on my list that, okay, I've done an observation. That's not what I wanted. So I didn't go for MoveFields, even though I was getting it. So that's an
Okay,
individual thing. You can do more. MoveFields offers almost 4 weeks to 6 weeks, but the money changes accordingly. So MoveFields is fine if you want to go there. There are other institutes as well, but it's very difficult otherwise in other colleges to get an observership.
okay, ma'am. Thank you, ma'am. Thanks a lot.
Yeah.
Yeah. So, Dr.
Thank you.
Then, so how did you manage the like you were staying on your own expenses in UK?
I'm staying at my friend's places. My
Okay.
cousin is there.
So if you have some options to stay, then maybe you
Yeah, like
can
talk to
manage.
I had a lot of friends, no, my UG college, my PG
Yes, yes.
college. I had a lot of friends there, and like my cousin was there in London. My exam was in Cardiff. I stayed at 2, 3 different places. So that's how I managed because I had to attend a course in London also. The London Eye course. I did that. It was a 1 week course in London. Then I wanted to give a mock exam by London Eye course. I did that. Dr. Mustafa Dovidar had a enter segment examination, posterior segment examination. They had a proper course on it, like a day on it. So I went there. I was able to, he showed everything over there. Did it on colleagues. So that was also near to London. So I did that. Then I was in touch, like I already had my sessions with international candidates right from India. So I continued that while I was staying in the UK. And Cardiff, I had booked my stay for the exam purpose. The exam was lasting for 7 days, 5 days, and you get any 2 days out of it. So 1 day is your Viva exam, 1 day is your oral exam or ski exam, and there's a gap in between. 1 day gap depends. Some people get 2 days gap. So I had to stay there, and yeah, I've just come and given the exam. Now I'm waiting for the results.
I think other option is if you're a resident, you can even maybe try for exchange program. I think DNB also as a
Yes.
resident you can go there for but then you cannot go there for a long period of time. Maybe I think it's a month's time maximum you can be there.
Yeah, yeah.
That is the other
And
option if you want to go there.
yeah,
And
yeah, you can try that. Yeah.
And the other options is obviously the ICO route or the IOFF. But as Dr. Hemali said, then you would be wasting your opportunity for an observership because you wouldn't be able to give the
Exam.
opportunity of learning, and you may not be able to study also. So you again waste the opportunity of going there and not being able to give your best for the exam if that is there.
So when you
Yeah.
apply for the UK visa, you get a 6 month visa. So what
Okay.
you can do is you can go there, you give the exam, you stay back, and accordingly plan your observership in such a way that after the exam you do the observership, or you do the observership and take 2 months gap and then do or come back to India And then, but if you are going once and you want to stay, give the exam first, then you want to do the observership, and then you can come back. In the meanwhile, you get your results as well. So
Okay.
it just, yeah, fits into place.
Thank you, ma'am. Thank you, sir.
Yeah, you're welcome.
I think we have another, maybe I think you have already cleared that, but regarding GMC and FRCS, there's still a confusion. So FRCS is not considered for
Yeah, and even if you want to become a consultant, in you see, you might get jobs. I mean, initially, before what has changed right now, FRCS Glasgow was getting GMC. That has been scrapped now. So
Right.
people who already got FRCS Glasgow, they were able to get the jobs later on, but they cannot become consultants in the UK. To become a consultant, you still have to give FRC off. So
Yeah.
why waste money in getting all the other degrees if eventually you will have to give FRC off?
Yeah. And then
So
you will
that
not
was
get
one.
any concession also in the exams. You have to
Yeah,
do all
there's no
the exams.
concession. You have to give everything from the start.
Yeah,
So
so
what's the
you
point of
waste
wasting
time
so
as
much
well.
money? Rather, take the toughest route and get through it, because it's not like, it is a challenging thing and it's something you can get through. So it's fine. Like, that's how I planned it. I didn't want to waste money here and there, because I
So
did give FICO actually, and I shifted to FRCO.
I think ICO people have a lot of misconceptions that it is going to give us some job.
Yeah, same thing. I did that mistake. I gave both my exams. I cleared it as well. And then I was like, no, let me search. And I was looking, because there was no one to guide. All my seniors gave ICO. All my
It-
grand seniors also gave ICO. Everyone was giving ICO. I was like, okay, let's do it. But then I realized that ICO is not actually going to give me much.
it's difficult sometimes to convince also to tell the residents that yeah, it's there's nothing harm in giving, but if you are planning for something, if you are focused, then maybe it's like people think that if they give ICO,
It
they
just
land up with jobs.
No, it won't. It won't. And it actually just adds on to your degree. It looks very nice, shining around your MS or
Right.
degree. It looks
Yeah.
nice. Definitely. And people know that FICO is not easy. The exam has taken a lot of it. Like, it's about money, it's about the efforts, about time. So we do know. But then the outcome is like, you still cannot get fellowships in the international countries to a significant extent. You do not get to work in the UK. You do not get to work in the European countries. Australia is out. Middle East is again a problem. So, like, do something which actually gives you an upper hand.
So, so I think this also you have covered. FRC Opt will give you consultant post, right?
Yes, you to become a consultant in the UK, you will have to do FRC off. Well, that is a Caesar pathway actually. So
Right.
Caesar requires another set of things to be able to get through, but FRC off is one of the major components of it.
Right.
So if you ever want to become a consultant in the UK, you will have to get FRC off eventually later on. And of course, other things, you have to show your logbooks. There are a lot of Caesar requires a lot of
I
data.
think it will take 1 to 2 years of plan.
Yeah. Entirely. So it's difficult. Initially, Caesar passing rates were also very less, but now I've seen in the Caesar groups, which I'm a part of, a lot of UK-based Indian consultants are getting Caesar passing rates are good nowadays, which is hopeful. Yeah.
Okay, so I think we need to let Dr. Himali go. She's been giving us a lot of information, and we'll catch her maybe for another session if she has time. And this okay, we have one more question. Maybe Dr. Ambikesh, maybe you can take the mic if you have. Okay, so you needs to know how do you plan the finances, or what is the
Hello.
amount you have
Hi,
to.
sir. Can you hear me, sir?
Yeah, please, Dr.
Uh,
Ambikesh, go ahead.
just wanted to know, preparing for all 4 parts of exam, and as ma'am already went to UK and did uh, some of the courses also there. So just approx like how much it costed.
Okay, tough question. It's like
Just approximate, like I
it
just
it's
rough
see
figure.
it depends on your lifestyle also. It depends on how nervous you are that you buy every single question bank on the market and then you solve everything, which I did. And then I did all the courses that were available. I tried to do almost every course that was available. I could not do one of the courses because it was in Feb, and I traveled to UK in March, early March. So it depends on that. But the courses are expensive, as expensive as the exam itself. So
So
the
I
London Eye
think
course was pretty expensive, around £1,000. So it's tough. The question banks are tough. So what I used to do is I used to kind of share, like, with yeah, that is something we can do. It's some places you can, it's not, so check every Q bank, see if it's allowed, if that Q bank is allowed to share, then only do it. Don't do anything illegal. Just make sure that you're legally all right to be able to share it, and then go ahead with it. And as I said, iDocs, don't waste money into iDocs. I've done that, so don't do that. Off the bank is, if money is a concern, iAcademy, you can split it with someone, share it, or off the bank is a little cheaper, closer to the exam. iAcademy is also close to the exam, but off the bank was very, very close to the exam. Like, I remember the questions literally. So yeah. And off the queue is essential. I know it's a very expensive Q bank, very expensive, but it builds your knowledge to another level. Like, US based ophthalmologists also are a part of that uh, uh, platform, actually. So there's a nice forum of the queue, and the questions are high standards, high standards. So that is very good. Like, give any exam, I would say. FRC Glasgow, FICO, after Q is wonderful. Like, it just builds you. So that is something you cannot not do, I would say. I've literally told all my juniors, all the FRCopth aspirants, to definitely try off the queue. What you can do is you use it for 3 months, then maybe share it with someone. That would reduce your cost to some extent. I don't know if it's allowed or not, but that would help. Use all the discount codes available. You can do one thing is off the queue. You can always renew it. Renewal costs you lesser. So all are these individual things which I can definitely share on a personal basis. I'll give ideas and hints about how to save money, which I have tried. Everything I've tried. So yeah,
So roughly, what is the cost for these courses or these Q banks
they're
usually?
expensive. In the terms, like, off the queue cost £500 for 6 months.
Okay.
iAcademy £300 for 6 months. Off the bank was £50, which was cheaper. iDocs is around 8,000 to 10,000 Indian rupees for 3 to 4 months. But iDocs is, I just had a bad experience. Not, and all things, like, part one was outdated. I trusted it in part two. Even part two was outdated. It was, but still, I mean, I've done it. I wasted my money on it, so I'm telling, don't do it. But iDocs has a good forum, so be a part of it. It's very helpful. And Revise and Conquer is also a good platform. It's just that expensive again, but it is for oral exam. And when you reach that platform, reach out. I'll try to give my best and advice at that point of time what is available, because I'm definitely in touch with a lot of international people uh, in the UK, other countries as well. So I have a slightly better idea about things just because I have gone through it. So I am here to help if you guys want to reach out for anything, any query. Yeah.
Definitely. I think so we know that this is one exam where we have to be focused. It is
Yes.
not that we can just like "Ki chalo."
It's like, can't afford to fail. No, it's very expensive, and the amount of
Yes.
time is going into it.
Yeah. So
And
just
the next exam might be even expensive than the one you failed. So
just like
be,
anything, we have to be focused. And
yeah.
as Dr. Hemali mentioned again and again, that these are all doable. So
Yes.
we shouldn't get disheartened that about the passing percentage or this is what we have to do the curriculum. But these are all doables. It's just that you have to do, you have to put in the efforts, and then you definitely will reap the benefits. And as she said, even for retinoscopy, I think any resident in, at least in India, there is no this that there will be lack of opportunities. Yeah, if when our laziness or whatever we call it, if we don't practice, then we have to then search for other opportunities after our residency. But if you are planning for UK or if you are planning for FRC op, then from the first year itself, and that is the time when you are exposed to retinoscopy, you should plan it accordingly, read what is there in the website, and go it in a systematic and proper format. This will not just help you for your exams, but even in your clinical and day-to-day practice. So just go ahead with the exams, and Dr. Hemali is always there to guide us. So, and we'll learn from her experience. And thank you so much. It was
So
really
one last question, sir.
okay. Go ahead, please.
Sorry, I'm so sorry.
No,
I
no.
just want to know, like after FRC of and GMC, but before Caesar pathway, what level jobs we can expect?
Yeah, so you get junior level posts, specialist registrar posts, or trust jobs or non-trainee jobs. They are available definitely.
So
Like
we
they are,
can survive on those jobs, like we
yeah,
can
yeah,
have like.
they are better paid than what you would get in India or a residency program. So you can do that, but that is the entry level. So once you get NHS experience, you get it's like basically a registrar level post in India. And
Okay.
definitely work-life balance is much better than what you get in India. So
And we
that,
can get into fellowships as well.
yeah, fellowships you can, but it would be slightly difficult to directly get into a fellowship before doing a junior level post, is what my understanding is, because for me it was difficult. But again, I'll definitely update you about my experience once I get through. Like
Okay,
once
thank
I
you so
get,
much.
I'll tell you about my experience, how it has been.
Okay, thank you so much. Thank you, ma'am.
Yeah, yeah. Welcome.
Yeah. Yeah. Okay. Okay. Thank you, Dr. Emali, and thank you, everyone. And
Thank you. I just want to add one quote.
yeah, please.
So, it's by Eleanor Roosevelt. I wanted to say that, I mean, what he said, that the future belongs to those who believe in the beauty of their dreams. I added this because for me, I did not have much back support. I did not have so many people to guide me. My parents were so scared to send me to the UK. Like they were like, why she wants to go? And like I mean, my cousin went there very recently, so I did not actually have much support even in the UK as such. But it was in 2021 when I thought that why not? Why not just see whether what I can do? I mean, why not? Like, I just want to get affected. Oh, this exam, this is so difficult. I did not want to get bogged down. My seniors were like, do FICO. Why do you want to? No one has done this. No one knows about it. When what is even this? It was not heard about. But I was like, no, if I have to do it, I'll just do the toughest one and I'll just challenge myself. So I just dreamt that someday I'll get through, and I have faced failure as well. I have failed by 4 marks, as I said. It was very tough to accept that failure. But yeah, you have to dream those dreams to be able to see where you are. So that is what I want to say to you guys, that do not shy away from dreaming big dreams. You have to have that in you, and you will get through. So yeah, don't get nervous about things. And I'm here to support. Sir is here to support, and you already are lucky that you have such a wonderful platform. So yeah, go ahead with it. Thank you, sir. Thank you so much.
Okay. Thank you.